Today, beauty is defined in terms of youthfulness and healthiness. Growing aesthetic standards are presenting new challenges for dentistry and dental technology. Dental restorations are expected to be more durable and functional. They must also be indistinguishable from natural, healthy teeth. The Empress system has been developed by Ivoclar in close cooperation with the University of Zurich. The new procedure is suitable for fabricating inlays, onlays, veneers, and crowns that look as good as the real thing. Empress restorations are composed of ceramic for the most part. Once bonded with a modern adhesive system, they look like their natural counterparts. A strong, durable bond between the tooth structure and the ceramic restoration is achieved with the adhesive technique. Compared with conventional dental ceramics, Empress glass ceramic has reduced surface micro-hardness. As a result, its wear characteristics are between those of enamel and amalgam, a fact proven by Heinzmann and others at the University of Zurich. Preparation and seating of inlays. The inadequate restorations of the second premolar and the first molar will be replaced by Empress inlays. First, the old amalgam restorations and any caries are removed. The shade of the restoration is determined. Sharp angles between the preparation floor and walls are avoided by using a tapered diamond. The preparation walls are almost parallel. Depending on the inclination of the cusp, they may vary slightly between 6 degrees and 9 degrees. Deep dentin should be lined. Viviglass, a light-curing glass ionomer liner, is used in this case. Finally, the enamel margins are finished. The preparation margins must show up clearly on the impression for the dental technician to fabricate an accurately fitting restoration. Light-curing Febit is particularly well suited for temporary restorations. In which case, temporary eugenol cements that inhibit polymerization are unnecessary. A small temporary grip is attached to the inlay fabricated in the lab to facilitate manipulation during try-ins. The glycerin in the preparation should fill out the cementation space. The shade may already be determined at this point, as light refracts in almost the same way as it will with the luting composite at a later stage. Subsequently, accuracy of fit and contact points are checked. The occlusion is not checked at this point. The first step in preparing for cementation is the removal of the inlay from the preparation. At this stage, at the latest, the field should be isolated with a rubber dam or quick dam. After the restoration has been tried in, it is rinsed and dried. The preparation is cleansed with a commercial cleanser and dried thoroughly. The following 3 steps help to establish an improved bond between the ceramic material and the luting cement, as well as between the luting cement and the tooth structure. Etching, bonding, wetting capacity. First, the ceramic side is etched with hydrofluoric acid. This step can be carried out either in the lab or in the practice. Then the enamel is etched with phosphoric acid. Next, the ceramic side is simonized with monobond S. Syntac primer and adhesive are applied to the cavity preparation. Finally, Heliobond is applied to the ceramic as well as to the tooth to increase wetting. All materials must be dried with a stream of air after application. These 3 steps may be carried out simultaneously in the practice. The large picture shows the work directly on the patient. The upper left-hand corner shows the assistant's work. The tooth is etched with phosphoric acid and the inner surface of the ceramic with hydrofluoric acid. Tooth enamel should be etched for 30 to 45 seconds and ceramic for 60 seconds. The acid is rinsed off and the surface dried. The rinsing medium containing hydrofluoric acid should be neutralized before disposal. Please observe the safety measures. Syntac primer is applied to the preparation for at least 15 seconds and then dried. Syntac adhesive is applied in the same manner for 10 seconds. Then Monobond S is brushed on the inner surface of the ceramic for 60 seconds. Heliobond is brushed on both parts. It is important to thin the Heliobond thoroughly with air. Heliobond is not fully cured at this point. The assistant mixes the luting composite. Variolink or time-tested dual cement is used. Then the mixed composite is applied to the preparation. The inlay is placed in the preparation. Under slight pressure, excess composite is forced out through the cementation space. Excess is then removed from the occlusal area with a spatula. While the assistant holds the inlay in the preparation, the dentist carefully removes proximal excess with dental floss. The luting composite in the cementation space is liberally covered with glycerin to assure complete polymerization. Liquid strip is used to protect the composite from contact with oxygen. The occlusal surface is light cured first. Adequate time, at least 40 to 60 seconds, should be allowed for this step. Polymerization of proximal regions is facilitated by light wedges. Although the greater part of the Variolink cement has already been polymerized, it is still necessary to take great care. Adequate time, at least 1 minute, should be taken for polymerization. Then the grips are broken off. The rest of the glycerin is removed by rinsing thoroughly with water. Occlusal excess is carefully removed with tungsten carbide or diamond finishers. Particular care must be taken in the proximal region. Excess is located with dental floss and removed with a suitable instrument. The quick dam is removed before the final occlusal check. Initial contacts are removed with a diamond. Silicone polishers are suitable for smoothing Empress ceramic surfaces. The areas adjacent to the inlay are fluoridated last. In this case, Fluor Protector is used. Inlays made from IPS Empress ceramic are difficult to distinguish from natural tooth structure. IPS Empress ceramic is an ideal restoration material for discerning patients, as it offers many creative possibilities and has excellent physical properties. Preparation and seating of veneers. A veneer will be placed over the retrusive number 11 tooth of the patient. The following requirements must be observed when preparing a veneer. The preparation ends in a deep chamfer at the gingival margin. Contact points are maintained. Incisal guide cuts are made to facilitate placement of the veneer. The enamel surface is etched carefully for provisional cementation of the veneer. A composite material replaces cutback tooth structure. Once the veneer is ready to be seated, the temporary restoration can be removed easily. Any composite material remaining on etched areas is cut back. Again, glycerin is filled into the cementation space before seating to achieve light refraction similar to the luting cement. A grip is also attached to the veneer to facilitate handling. The veneer is tried in to check accuracy of fit and shade selection. Then the veneer is removed from the mouth. The enamel surface is cleansed as usual. 3 preparatory steps for an improved bond follow. The large picture shows the assistant's work on the ceramic. In the upper left-hand corner, work is carried out on the patient. First, the ceramic is etched with hydrofluoric acid. The enamel surface is conditioned with phosphoric acid. After 60 seconds, the hydrofluoric acid is rinsed off thoroughly. The rinse water is collected in a plastic cup and neutralized. An etching time of 30 to 40 seconds requires a rinsing time of approximately 20 seconds. Monobond S, a silane preparation, is applied to the ceramic for 60 seconds to achieve a bond between the inorganic ceramic and the organic resin. Syntac primer and adhesive help form a bond between the enamel, dentin, and composite. They prevent polymerization shrinkage of the luting composite. To improve wetting of the etched surface, Heliobond is applied to the inner surface of the ceramic as well as on the tooth and thinned with air. Final polymerization with a halogen light is not carried out at this point. Again, a luting composite is used for bonding. Once the veneer has been ultimately cemented, excess is removed. To prevent polymerization from being inhibited by oxygen, the entire cementation space is liberally covered with glycerin gel. Veneers are polymerized beginning with the incisal region. The remaining marginal areas are then polymerized for an adequate amount of time. Subsequent work is done in the conventional manner, as previously demonstrated. The final step involves fluoridation of the marginal regions. Veneers are a gentle solution. In combination with the adhesive technique, veneers present a durable way of restoring discolored or anomalous teeth using minimally invasive procedures. Preparation and seating of crowns. The central incisors of the patient will be restored with 2 Empress crowns because of an unsatisfactory composite restoration and misalignment. The picture shows the clinical situation after preparation. A circular shoulder or deep chamfer are particularly important in crown preparation. Finishing the prepared tooth terminates crown preparation. In the final step of crown and veneer preparation, it is particularly important to determine the dentin shade of the prepared tooth. By working on the same shade basis, discrepancies can be avoided once the restoration is seated in the mouth. In contrast to what was previously shown, the crown has already been etched with hydrofluoric acid in the lab. Before trying it in, the crown is filled with glycerin to help determine the shade and, in this case, to protect the etching pattern. Accuracy of fit and proximal contacts are carefully checked. If the try-in is satisfactory, the crown is removed and the prepared tooth cleansed. The inner surfaces of the crown are also cleansed. This is done best with phosphoric acid. Subsequently, the inner surfaces of the crown are rinsed and dried. Monobond S is applied to the inner surface of the crown. Syntac primer and subsequently Syntac adhesive are applied to the crown preparation for an improved bond. Then, Heliobond is applied to both marginal regions. Blowing the Heliobond to a thin layer is particularly important at this stage. As the material is light curing, direct exposure to light should be avoided. The crown filled with luting composite is carefully placed on the prepared tooth. Excess composite extruded at the margins is carefully removed with a curette or similar instrument. Proximal regions are cleaned with dental floss. To prevent polymerization from being inhibited by oxygen, the cementation space of crowns must also be covered with glycerin gel. As with veneers, the incisal area is cured first. Subsequently, the remaining areas are also light cured. Fluoridation of the marginal areas terminates the seating procedure. With IPS Empress, you can achieve restorations that are difficult to distinguish from their natural neighbors. Crowns, veneers, and inlays made from IPS Empress are small works of art by dental technicians. Once seated by the dentist according to state-of-the-art techniques, these restorations assure excellence in aesthetics and function.
For your convenience, this IPS Empress Mini Sem Kit, a complete system for the clinical build-up and cementation of IPS Empress veneers, inlays, onlays, or full crowns, is available from your IPS Empress Dental Lab or your Ivoclar Vivident Dental dealer.